Okay, now we have partially edentulous patient, free and saddle here, and we have defect, combined vertical and horizontal defect. As we said in the lecture, we're going to check how deep is the defect. I can see here it's 15 millimeter the length, and I can see that it's almost 3 millimeter vertical defect. So I'm going to use this membrane. If you see, this membrane is especially designed for this situation. It's already trimmed from this side towards the tooth, and you shouldn't use the membrane in the other way. You should use it in the perforated part. The rough part is towards the soft tissue. Okay, now we can determine the end of the end shape. What is the result we are going to reach? For example, I want to get 10 millimeter here horizontal and 12 millimeter here. Okay, so I am going to first use my tissue forceps. Okay, I am going to bend the membrane from here like this. I'm shaping the membrane, and I'm going here, for example, I will measure again from my bend. This is 10 millimeter and this is 12. So I am going to use the membrane like this. Okay. Now it's 10 here, and it's almost 12 in this area. Okay, now I want to check the adaptation of the membrane. This is where I can fix the membrane. I have to check where I'm going to fix, make sure I'm covering this area. And here, again, here, if you can see, I will check where is the mental nerve. The mental nerve, for example, is here, and I'm going to be here. So I'm going now to make a notch in the membrane to avoid the mental foramen. So I should do this before the surgery. If I have a printed model, I can adapt it, or during the surgery before adaptation and fixation of the membrane. Here. And here. So now let us see how's it going. Now I am away from the mental foramen. You can put your screw here and you continue the fixation all around. This membrane is a bit too long, so I want to end, for example, in this area. As I see before, it's around 15 millimeter. I will add 5 more for the fixation. So here I see this is 15, and I can end with this line. I'll try to leave more edges of the membrane, because I will use them for the fixation. Then I will trim them later. Okay. Now it's okay. I can see my membrane. If you see here, this is exactly where I want the future shape of the ridge to be. Okay, now there are many ways to start the fixation. Either your assistant hold the membrane in place where you fix this part, or Eastern Urban was using a temporary pin here. You're putting a temporary pin, if you see, then he fixed the lingual, because any rotation of the membrane will make it very hard to reorient it later. So I will ask my assistant, or if you are putting implant and making simultaneous implant grafting and implant and bone grafting at the same time, or a tenting screw is here, you can put your finger, fix it until we make the first screw. Okay. Now I will put the first Profix. I will ask you to fix the membrane in place with the tweezer. Put gloves, please. Okay. Now I need the membrane to be in place. I have to change the mode. Okay, I will start with fixing here. Is it clear? Okay. Very slow movement. Okay, this is the first screw. If you see everything in place, let's do the next one. The next one is not easy one, is here. I will fix here. No need to extend the membrane too much behind the last tooth from the lingual side. And I'm going to fix here, and this excess, most probably I will cut them in the end. Okay. If I find the screw is not in the right place, I can remove it and put it again. But here I can continue with the manual driver and see if I can continue. I will do. Okay, this is the second screw. Okay, now I can put graft from the labial side. I raise the membrane from here, make sure it's away from the saliva. I put gauze between the lingual flap and the membrane. My assistant taking care of no contamination with saliva. This is your enemy during the surgery. Any contamination can cause, even if it is, you cannot detect with your eyes, but it can later on affect the healing process. Okay, so we can raise the membrane like this, and now we have the space to put the graft. And I will ask my assistant now to put the graft below the membrane. Give me one graft. It's here.
Yes.
Use this. Use this. Yeah. Give me the graft here, please. Put the graft here. Okay. Yes. Very good. More. I need more. Is it clear? Okay. Okay. Yalla, more, please. More. Okay. Give me some more. Okay. Very good. Now you can mix more graft. Put more graft here. Remove it. Remove the seal. Yes. And you can add some saline from here. Okay, now I check the adaptation of the membrane. Okay, we need more graft before we can fix the last screw. Yeah, put all please. Put some saline. Okay, then you have the mix and the gauze. This is the situation now. Yalla, give me graft. Thank you so much. More, put more amounts. Before the next screw, you should make sure that you are covering the crest of the ridge because you are doing vertical augmentation and some part of the horizontal augmentation. Okay. Okay. This is good for now. I will check. Give me this, please. Okay, let's check now. Okay, now we can start fixing the disc to buckle screw here. Okay, I will get one more Profix. Clear. Okay. And then I will fix the disc to buckle one. Okay, and now the last screw on the medial buckle, this one. After this, I can finish this with the remaining with tacks. Even this can be done with tacks, this last one. Okay. Now I have fixed the membrane all around. If you want to remove any excess, you can use your blade after you fix the membrane. If it's touching, for example, adjacent teeth, you can, if I want to remove some from here, clear? Okay. I can use the blade and cut any contact. It shouldn't be contact adjacent teeth. There should be around 1 to 2 millimeter even space from the adjacent tooth. Any graft touching should be removed. Then you can finish your case with 2 or 3 tacks here on the buckle. You don't need here Profix. This is very accessible, and you should put one on the crest here, on the distal one. Then I can cut this excess, all this excess with the blade as I showed you here. Let's do one more here. I think we need one more prefix. We can stop.